Our next bill that we have today is House File 3711, Representative Hicks' bill. Representative Hicks, if you'd like to come down to the testifier table. Representative Hicks, would you like to move your bill?
Yes, Chair. Thank you.
Okay, Representative Hicks moves to re-refer House File 3711 to the Human Services Finance Committee. If you'd like to go ahead and introduce your bill for us.
Thank you so much, Chair and committee members. I am excited today to share a little bit about House File 3711, which will allow out-of-home respite for children to be offered in an unlicensed setting. Respite is a vital service that supports families throughout the state. Access to safe and reliable respite options is crucial for families needing to take a break from their caregiving responsibilities. In 2020, a change was made where out-of-home respite for children could be provided, limiting the service to only licensed settings. This change resulted in the loss of trusted options for many, many families, and also availability for many families. With me today is Sarah Grastrom from ARM, and ARM has been engaging in conversations with the department since this change was implemented and worked through language to try to find a solution to this problem for families. I want to be clear, we are still having some of those conversations as we look to make sure that this is both safe but also accessible. I'd really like to turn the attention to two letters that you'll see in your files really talking about how important this is, and I will let my testifier walk through the bill language.
Okay, very good. Thank you, Representative Hicks. We'll first go to Ms. Sarah Grafstrom. If you'd like to introduce yourself, who you're with, and welcome to the committee.
Thank you. Good afternoon. Yeah. Mr. Chair and committee members, for the record, my name is Sarah Grafstrom. I am the Senior Director of State and Federal Policy at ARM. ARM is a statewide trade association of residential service providers providing services through the 4 disability waivers and supporting people in a variety of different living environments, from a 4-person community residential setting to an individual's own home, and through a variety of different services, including 24-hour daily services to unit-based services that might be provided just a few hours a week. One of the services our members provide is respite, both for adults and children. Respite can be provided as a daily service when an individual is accessing services for 10 hours or more in a day, or as a unit-based service, which would be used for anything under those 10 hours. Respite can be provided in an individual's family home, in a hotel, at a camp, or in a licensed setting, and for adults in an unlicensed setting. Respite can be provided by a family member or a person working under a provider's 245D license. The bottom line is respite is a unique, critical service that providers tailor and develop to meet the unique needs of their community and the people that are utilizing this service. The bill in front of you today is specific to out-of-home respite for individuals under 18 when the person providing the service is not related to the person receiving the service. In 2020, a change was implemented by the Department of Human Services that restricted where this particular type of respite could be provided. Prior to 2020, the service could be provided in a licensed 245D setting or in an unlicensed setting, as long as the provider had a 245D license and appropriate approval was received from the child's case manager and legal guardian. An example I often use that our providers shared with me of a situation that they used to support is a retired special education teacher who has a strong relationship with the family and her community and provides respite in her personal home 2 weekends a month under their local provider's 245D license. The service itself is licensed, but that teacher's personal home was not licensed. To keep providing the service following the change in 2020, that teacher would have to have her home licensed by the Department of Human Services. This change has drastically reduced the amount of available respite, specifically in Greater Minnesota, where finding a licensed setting with an opening for respite can be hard to come by. The loss of respite options have contributed to some families going into crisis and having to seek other options to get support for their child and their family. The bill in front of you will allow for this service to once again be provided in an unlicensed setting when certain qualifiers are met and with certain guardrails included. To walk through some of those first, a background study must be completed for anyone over 13 living in the home. The child's case manager must conduct and document an assessment of the home. The child's guardian or legal representative must visit the home before the child goes to that home for respite. The service must be provided in a residential setting. No more than 4 children can be receiving the service at any one time, and everyone has to have their own bedroom. Services cannot be provided to children and someone over the age of 21 in the same residence at the same time. And finally, an individual can only be in these unlicensed respite settings for 10 consecutive days and no more than 46 calendar days in a year, unless an exception, as written, unless an exception is requested by the case manager and approved by the Department of Human Services. To close, we know that respite is a critical upstream service that supports families. Without access to reliable and safe respite options, families are turning to alternative placements for their children, including more congregate living settings and even emergency rooms or hospitalization. We are grateful for the department's collaboration on this legislation, and we are hopeful that by passing this bill, families will be able to find options for their children in their own communities that they feel safe and comfortable with. So with that, I'm happy to answer any questions.
Thank you, Ms. Grafstrom, for being here. If there's questions, we will call you back, and we'll go to the next testifier. I have a Tyler Langenfeld. If you'd like to come down, please. Welcome to the committee. If you could please introduce yourself, who you're with, and begin your testimony, please.
Thank you very much. Good afternoon, Mr. Chair, committee members. My name is Tyler Langenfeld. I live in Hastings, Minnesota, and I am the Senior Director of 245D Services at ACRA, Minnesota's largest home care provider. Thank you for the opportunity to speak today in support of House File 3711. At ACRA, our mission is to improve lives by providing individualized home care supports and services to people in their homes. We accomplish this mission by offering a variety of service options, including out-of-home respite services under our basic 245D license. Specifically, ACRA administers out-of-home respite services for children and adults in unlicensed settings, essentially in the homes of the individuals we hired to become the employees. As you can imagine, families face many challenges when attempting to locate potential staff to provide out-of-home respite. Family members, coworkers, neighbors, friends, these are just a few of the places that families look for staff to help them access these critical and well-deserved caregiving breaks. However, in 2019, with the passage of more restrictive language, families who were looking for out-of-home respite for their minor children in an unlicensed setting saw this same list of potential sources of staff shortened to only family members. At that time, ACRA, as an agency, publicly commented that, quote, requiring unlicensed out-of-home respite providers for individuals under the age of 18 to be related to the child dramatically reduces an already shallow pool of potential staff. This new language unnecessarily places an additional obstacle in front of families who are trying to overcome a workforce shortage already identified by the state of Minnesota, unquote. As I said, that language was from 2019, and I think we can all agree that 4.5 years later, families are still navigating that same workforce crisis. When this change went into effect, ACRA and other providers were put into a position to call all of our families with minor children accessing out-of-home respite to discover which employees were related and which were not. The staff who happened to be related, they could stay on, but the ones who happened to fall into those other categories, like friend or neighbor, their opportunity to provide out-of-home respite to their clients was over. I remember personally speaking to a longtime staff who called and asked why they were no longer able to provide out-of-home respite to a family they had been working with for over 3 years for no other reason than not being related to the child. New rules was the only answer that I could give them. As you can see, this restriction not only affected families seeking unlicensed out-of-home respite for their minor children, but also the employment of some of the people willing to provide the service. House File 3711 will work to remove this additional obstacle for families with minor children looking to access out-of-home respite in an unlicensed setting. Initial and annual assessments conducted by the child's case manager and legal representative, as well as ensuring that background studies are conducted on individuals age 13 or older living in the household, is a reasonable and sensible compromise. One that we believe will continue to help ensure that children who are accessing this vital service are receiving care in safe environments while not assuming that those same safe environments can only be provided by related caregivers. ACRA strongly supports House File 3711, and I thank you again for the opportunity to speak on its behalf. I'd be happy to answer any questions that you have, and again, thank you for your time.
Thank you so much for your testimony. If we have any questions, we will call you back down. Thank you. At this point in time, are there any other testifiers who'd like to address the committee? Not seeing any. Next, we'll move on to members. Any questions or comments? Representative Backer.
Yeah, thank you. And I appreciate not calling me Baker. Thank you, Chair. On the serious note, Representative Hicks, my question is, so we're going to go, how does this work with someone who's not licensed? You know, from what I understand, and correct me if I'm wrong, these individuals, even though temporary, are going to be put into an unlicensed type of situation. Am I understanding that correctly?
Representative Hicks.
Thank you so much, Chair. Yes. So I'll let Sarah speak to some of the details, but she did share an example that is actually really common in my community, which is retired special education teachers. So a family maybe has a child who is severely impaired. Maybe the child has a feeding tube and is nonverbal and requires all of their personal cares be done by someone else. Their feeding, their bathing, their toileting, that kind of thing. And so that parent is doing a lot of that care in the home. They maybe have a PCA that comes in some, the child goes to school, but they really are providing the bulk of that care. So maybe mom and dad want to go away for a weekend. Or maybe they want to have a weekend at home. Maybe mom has surgery and dad wants to be able to focus on supporting mom for that weekend. And so the special education teacher, like the one in Sarah's example, could be hired by one of our 245D licensed providers, have a background check. The case manager, the county case manager, and the parent would go and view the home and say, we'd really like Miss Smith to support us for these 10 days while mom's recuperating from surgery, because Johnny knows Miss Smith really well. The way the law is currently written, that's not an option. And so unless the case manager can find a licensed facility for Johnny, who's maybe 12, right, to go to while mom recuperates from surgery, there's no option. So then dad has to try to find people to come into the home, maybe, to help in those 10 days, or maybe Johnny has to go, ends up in an emergency room because dad can't balance everybody's cares. Or maybe mom ends up having to go to a nursing home for care for those 10 days because there's not enough people in the house to provide the care. And prior to 2019, we allowed that. And this has been a change now where it's only family. So I'll let Ms. Gresham speak further, but that's one example that I've heard about in our community is like a parent needs surgery or needs care and they can't use unlicensed respite.
Ms. Grafstrom, anything you'd like to add?
Yeah, thank you, Chair Fisher and Representative Backer. Representative Hicks did a great job explaining it. The only thing I would add is just to emphasize the fact that the service itself is licensed. The person receiving the service is hired by the licensed provider. They have to go through all of the same training as the other staff would. They have to have the background check, all of the different 245D required trainings. The only unlicensed piece is that physical home that the kiddo is going to. And in the bill that we have, there's other safety measures in place to make sure that that home is safe. The case like Representative Hicks said, the case manager is walking through the home. The guardian is walking through the home. All of those things are in place to make sure that the home itself is a safe place. It's just not bringing in the department and physically licensing the home.
And I would just like to add, Chair, before
Representative Hicks.
I would just like to add, I really trust parents and case managers to figure this stuff out as a team. I really believe they can do that. I believe that parents are doing what's best for their children at all times. Most people are trying their best just to get through the things they need to get through. And so I really trust case managers and parents to identify those situations, and I trust them to work through those processes together as a team.
Representative Backer.
Yeah, just a quick follow-up. So if I'm hearing you correctly, what you're saying right now is that the individuals that would be providing the care would go through the process. Because my concern, I would agree with you, Representative Hicks, parents are the best advocate for their children, hands down. My concern is, as you're well aware of, when you're in that situation, there are times that you let your guard down because of the stress of the situation, because, you just like to want to get through it. So of course I want to make sure those kiddos are in good care. And your scenario totally is a good example. Unfortunately, when we sit on this side of the table, we also have to look at who could be the bad apple. As we know, we will make laws that bind to that. My last question here: where does the department weigh on this? Is this? I don't know if someone's here from the department. Where do they? Because they would have to administer it. Or maybe Representative Hicks. I don't know. I don't want to put you on the spot.
Representative Hicks or somebody from the department? Looks like we have somebody coming from the department. Welcome to the committee. If you could please introduce yourself.
Thank you, Mr. Chair, committee members. I'm Larry Hosh, manager of the policy team at the Office of the Inspector General. The department has been working with the sponsors of this bill for quite some time. We agree that respite services are a critical component and a needed service for our children. We do have some concerns with the bill, and we're working with the authors on that, trying to work on some understanding the authorizations that we have for conducting background studies and ensuring that we have that authority. And then also some of the exception language in the bill we're working with the authors on.
Okay, very good. Thank you. And I also know this will be eventually going to Human Services Finance Committee, so you'll have time to work on that for the next stop also. Representative Macker.
No more. Thank you.
Thank you. And next I have Representative Baker.
Mr. Chair, and thanks. I think the idea of this bill, Representative Hicks, is pretty aspirational. I mean, it's a great idea. Respite is important for our families, especially when moms and dads don't get that break. I, like you, want to trust all these folks, but what it gets down to is we've got a lot of issues right now that we're trying to just get the department where they can actually catch their breath and get to where they can stand up their current stuff that we're kind of shoving at them. And I'm a little concerned that with some of these concerns, and again, not knowing the real cost, which is, again, I know the next stop. But in your bill, if you could, how much could a family utilize this service? Would there be parameters? Is it once a month? Is it once a year? Is it every weekend? Help me just, what does that look like when it comes to how much of a respite offering should this bill try to offer people?
Representative Hicks.
Yes, thank you. I will let my testifier go into the details.
Ms. Grafstrom.
Yeah, thank you, Chair Fisher and Representative Baker. So there are specific caps in this bill of how many consecutive days a kiddo could be in an unlicensed setting, and that's capped at 10. So you can't, right now you can be accessing respite, I think it's for up to 30 days in a row in a licensed setting. This is capping the stay in an unlicensed setting at 10, and that's taking into account the potential of a family vacation or something that might last a little longer than the weekend. And then in total for the calendar year, right now the language caps that at 46 days for the entire calendar year. We do have language in the bill that would allow for the guardian and case manager to request an exception for that number of days. And that was one of the pieces that Mr. Hosh just referenced that we're still working on with the department. But right now in the bill, it is capped at 46 days in an entire calendar year for an unlicensed setting.
Representative Baker.
Thank you. Yeah, lots to work through. Again, I appreciate the department's, coming down and saying they're still working with this. I think it's a very good idea. I wish we were in a better place financially and, in other areas about this whole human service thing with our mental health crisis that we're under and so on. But again, I know this is that's what bill is. It's an idea. It's throw things forward. I'm just trying to catch up with a deep breath of what we're at and where we're at and where the department's at, because I get to see the department from a different light sometimes because of my other work. And so, again, I just I raised some concerns and looking forward to seeing what this looks like on the next stop. So thank you, Mr. Chair.
Welcome. Thank you, Representative Baker. Not seeing any other questions out there or comments at this point in time. Representative Hicks, would you like to make any closing comments?
I would, but now I'm in the same camp as Baker and Backer, so. Thank you so much for hearing the bill, and I just want to reiterate that this isn't becoming the Wild West. This is parents and case managers working to come up with solutions that work for individualized families, really focusing on that person-centered model for the children, their families, and really working with their case managers. So I just want to assure everybody, as a parent of kids with different abilities, I would never just be like, anybody can do respite. But I do trust families, and I do trust case managers to find people that make sense for their children. So I want to say thank you again for hearing the bill, and hopefully we can work out some of the technical difficulties that were.
Okay, very good. With that, Representative Hicks moves to re-refer House File 3711 to the Human Services Finance Committee. All those in favor signify by saying aye. Aye. Those opposed say nay. Motion prevails and the bill is re-referred to Human Services Finance Committee. Thank you to our testifiers and thank you, Representative Hicks.